Thank you, Mr. Speaker. My question is to the Premier. In my riding of York South Weston, we are home to many essential workers and have been designated by Toronto Public Health as one of high risk. The actions, and more accurately, the inactions of this government towards my community is very disturbing, and it is discrimination. Unlike other communities, we have zero mobile pop-up clinics and no permanent vaccine facility. When will the Premier acknowledge the risk our community faces and provide us with mobile pop-ups, clinics and a permanent facility that would help mitigate transmission, protect families and treat our communities with urgent, needed and not as an afterthought?
Mr. Health.
Thank you very much, Speaker. And in fact, the 34 public health unit regions across the province of Ontario are all being treated fairly equitably based and receiving vaccines based on population, based on risk, and identification of hotspot areas. In addition to that, we have a high priority community strategy of $12.5 million to support high priority neighbourhoods across the province, including in Toronto, which will assist with education and outreach, increased access to testing and vaccination, and wraparound services, including financial assistance and isolation centres to support self-isolation. So those are available across the City of Toronto, particularly in those high-spot areas, and will be available to anyone who needs them across the city.
And the supplementary question.
Thank you, Premier. Back to Speaker. Thank you, Mr. Speaker. Back to the Premier. We need the government to step up to the plate and provide mobile clinics promised 2 weeks ago without passing the park to Toronto Public Health or community health partners or blaming the federal government. Stop putting politics over people. This past week, a community pop-up was announced for the postal code in my community, one of the postal codes in my community. With the 24 hours, it was cancelled, with supply being the excuse. Many community members still lined up because the word did not get out. Why put the community through this emotional ordeal? Vaccine clinics shouldn't be announced without supply being secured. Mr. Speaker, I would like to know why the province seems to have no organisation, no plan and no rim or reason why it is other communities have day after day of clinics in York South, while York South Weston we have no permanent facility and no mobile pop-ups yet.
Minister of Health.
Speaker, well, I'm certainly pleased to advise the member that the reason why some of the cancelled vaccination areas are cancelled is because each of the 34 public health units receives their allocation through the ministry. They understand when their allocation is coming, how many vaccines they will be receiving, and then they provide the vaccines to the mass vaccination centres, to the pop-up clinics, some of the mobile clinics as well. In some cases, they are overbooked, even though those areas know what allocation they're receiving. I'm not certain if that's what happened in your situation, but we have seen it happen in other areas. However, there are mobile clinics that are moving through apartment buildings, places of congregate living for seniors, where they provide notices in advance of a day, and then they come through and will vaccinate everyone who wants to receive a vaccination in an apartment building. That is happening across the City of Toronto now, because we know that there are some groups of people that have vaccine hesitancy, or there are other reasons why they aren't coming forward. We want to make sure that everyone in Ontario who wants a vaccine can get one.